Hey everyone, welcome back to our channel. Today we are going to talk about some exciting news. And as you might have heard already, there has been a lot of talk about using artificial intelligence models to help people living with dementia. In particular, we are going to explore a hot topic in healthcare: how artificial intelligence can be used to make a difference for those living with dementia. Specifically, we will be covering a new article that just came out from a group at Cambridge University. The title of the article, as you can see, is Robust and Interpretable AI Guided Marker for Early Dementia Prediction in Real World Clinical Settings. And I encourage you guys to check out this article by yourself after the video to learn more. First, before we talk about the exciting new paper, let's briefly talk about dementia and artificial intelligence to have a basic background in this exciting topic. Dementia is a very complicated concept, but essentially it refers to a group of symptoms that affects cognitive functions such as memory and reasoning, but also affect psychological functioning such as behavior. It can be a very debilitating condition and unfortunately affects millions of people worldwide. Furthermore, dementia has many causes and is still a topic under active research. Lastly, I just wanted to mention that dementia can also be classified as either stable or progressive, depending on if the symptoms improve or continue to get worse or remain stable. Now let's turn our attention to artificial intelligence models, or AI. Recently, these models have received a lot of attention, especially in the media, partly due to their promise in healthcare in fields such as pathology and radiology. In particular, some studies in the past have tried using AI models to study dementia in patients. However, these models typically relied on invasive and costly data such as lumbar punctures and PET scans. Normally, these types of procedures are unfortunately inaccessible to a large portion of the population. This meant that these models would not be that useful to study regular populations, and furthermore, these studies would focus on a particular region or a demography, which would limit the diversity of patient data. In contrast, this exciting new study by Lee et al., which was released very recently, used widely available data such as cognitive tests and MRI scans, which are less invasive and lower in cost. Moreover, Lee et al. Used longitudinal data that tracked the patient's prognosis, which increased the clinical relevance of these models. Now that we have a brief background in dementia and artificial intelligence models, let's focus on the study itself. The researchers used 4 distinct cohorts for training their models and validation. It's worth highlighting that the training data contained longitudinal data, as I mentioned, and they basically had access to 6 years worth of data which tracked patients. Furthermore, these cohorts included patients from multiple countries such as Singapore and England, which meant that this study was very diverse in its demography. First, the researchers used the Alzheimer's Disease Neuroimaging Initiative, also known as the ADNI database. The data from ADNI was used to train the artificial intelligence model. Importantly, the training data contained individuals with mild cognitive impairment, also known as MCI. These individuals with MCI either remained stable or had their symptoms progress. And as you can see, there were 290 in the stable MCI cohort, while unfortunately 120 were progressive MCI as time went on. This longitudinal data allowed the model to be able to differentiate between progressive MCI and a stable MCI. And more importantly, be able to predict if the patient's dementia would get worse. Additionally to the training set, there was also a test set with the ADNI to make sure that the model was behaving as intended. And we can see in this test set, there were also individuals with CN who were cognitively normal, and also individuals with AD, which is Alzheimer's disease. To further test the validity of their AI model, the researchers used the QMIN MC database, which is from the United Kingdom, and the MACC database, which comes from Singapore. The researchers did this to show that the model would be applicable to different patient population and even different geographic regions. These two databases included MRI scans from patients, but also more importantly, they had cognitive tests, which allowed the researchers to validate their model to make sure that it's working properly. They also all of them included cognitive normal patients, patients with mild cognitive impairment, and of course, all patients with Alzheimer's disease, which shows really significant dementia. Finally, now it's time to discuss the exciting results that was obtained by the researchers' artificial intelligence model. In particular, the AI model was able to generate a prognostic index for each patient based on the training dataset. Basically, this is the AI telling us what it thinks the prognosis is for each individual patient. Specifically, in this case, a higher prognostic score means that the AI thinks that there is a worse prognosis for the individual. For example, to give a concrete example, a score of less than 1 means stable, while a score of more than 1 means rapid progression. This was tested using both the United Kingdom database and the Singapore database that I mentioned in the previous slide. And furthermore, the researchers tried using just data from cognitive tests or a combination of cognitive tests and MRI scans. And their model was surprisingly accurate or precise. For instance, in figure D, you can see that Alzheimer's disease, or the AD category, has a higher score than moderate MCI and mild MCI. MCI, as I mentioned, stands for mild cognitive impairment. So we expect patients with Alzheimer's disease would have a higher prognostic index, and that's what the researchers obtained. Furthermore, we can also see that, for example, mild MCI has a higher prognostic score on average than normal cognitive functioning individuals. So this shows that the AI model can distinguish patients based on their dementia status. Next, after validating their artificial intelligence model, the researchers turned their attention into fine-tuning their AI model. In particular, they wanted to see the effect of only relying on cognitive data, as this would even make the model more accessible, since MRI scans can be prohibitive in some cases. So the scientists essentially divided the groups into both MRI and cognitive data, or just giving the AI the cognitive data and asking it to perform the prognostic score. And what the scientists found was that the AI model still works without using MRI data, and the AI model is still pretty accurate despite not having access to any MRI scans. As you can see, figure B is not very different than figure A, and figure A is the one that the researchers used both MRI and cognitive tests data, and figure B is the one that was only based on cognitive data. And this shows that the model can also be pretty accurate or precise, even just on cognitive data alone, and it doesn't need MRI data to function. Lastly, the researchers used the prognostic scores generated by the AI model to predict progression of individuals with dementia to Alzheimer's disease. In particular, they stratified patients into three main groups: a stable, a slow progress, and rapid progress, depending on their prognostic score. They used the longitudinal data and used survival curves to keep track of the probability of not developing Alzheimer's disease or AD in each group. Interestingly, the stable cohort was least likely to progress to Alzheimer's disease, followed by the slowly progressive group, and rapidly progressive group was the most likely to develop Alzheimer's disease. This was contrasted by regular clinical diagnosis of mild and moderate cognitive impairment. So overall, the researchers' model of dividing patients into three groups, as predicted by the artificial intelligence model, showed to be more precise than regular clinical biomarkers. This also showed that the artificial intelligence model developed by the researchers is generalizable to healthcare population. Overall, while this is a very exciting breakthrough in the field of artificial intelligence and healthcare, we have to be very cautious, and more work is needed to actually improve these models and further validate them. Thank you so much for watching this video. If you liked it, please make sure to like and subscribe for more similar content in the future.